Dental Fuel, the podcast that focuses on what no one else is talking about: mistakes. The dental world is full of before and afters, and no one is talking about the middle. Dental Fuel brings you the unspoken in between. In our last episode, Dr. Naved Fatmi provides a look inside his previous role on the Florida State Board and provides expert advice for all practicing dentists. I want to jump back a little bit and talk about your role on the state board and how you kind of got involved with that, and what your role kind of entails. Is it similar to maybe in other states that it's appointed through the governor's office?
So I was appointed in 2015 with Governor Rick Scott, and 4-year plus 1-year term, so it ended in 2020. And I was part of a couple groups, in dental assistant group and continuing education, worked with all the schools in Bradenton, Dover, University of Florida, and sat on the anesthesia committee for 2 years. Sat on the probable cause for 3 years. So I was vice chairman in 2019 and the chairman for 2020. The job description is simple: is what's the right thing for the patient. If that's embedded in your head, if there was a difficult case on a probable cause panel, will this be okay being done on my family? Would this be okay on my mom or my dad being completed? And whatever the answer is, that's the answer. That's how you make the decision for the respondent.
And since I have you in this seat, and I haven't had the opportunity to ask anyone from the Florida board before, but Florida has their own licensing exam. Is that correct?
Correct, it does. We're
Why?
part of we are part of CDCA now. So
Okay. I guess while I was still in dental school, that was still its own kind of thing. And
that's changed since.
yeah. Okay. Interesting. What, if I may, and I'm not sure how much you can go into this, but what were some of the most kind of crazy, shocking things that you kind of saw play out from different professionals that maybe ran into some issues in the profession?
You can go into egregious stuff without mentioning name procedures, but
Sure.
I think to protect yourself, that's what the audience probably wants to hear, is proper note-taking and proper rapport and the communication with the patient. If the patient knows things are going to happen in dentistry,
Mm-hmm.
we practice dentistry. We practice it. Every day we're practicing until we retire, right?
Right.
So if there's proper communication with the patient and there's proper rapport building and the patient knows what's going on, and you're ethically going to fix it, and if something goes wrong,
Mm-hmm.
you're safe. I think the people that I saw, the respondents that really did get in trouble, was they intentionally ignored it or really didn't know what they were doing. Beyond their scope. That's what we called it. Beyond the scope of what they really can do. Not taking enough education on it. Just almost like a trial and error procedure, right? If you really go back to saying, this is, let's use an example of an implant placement. You have the CT scan, you have digital x-rays, you're doing a follow-up appointment, you're doing everything by the book. There's chances of the patient being upset. If there is a failure, it's a lot less.
So proper documentation, proper education, but definitely treat your patients right, and you'll probably be in the straight and narrow.
Just be honest. Hey, I'm going to redo this again, or I'm going to try to fix this for you. I'm going to send you to the right specialist. I think we would want that, right? If we were going into a medical office or something, things are going to happen, and we want to be communicated to.
Nothing like the truth and clarity on what's going on. If you had to provide a piece of advice to our listeners, I know you've provided some throughout our conversation, but what would that one piece of advice be?
Don't follow social media. This guy's doing this, this girl's doing this. Don't try to be the best in everything. I think we started the conversation with that. Understand your personality and maximize it. So 8 to 10 hours that we're working a day. Some people are working 6, some people are working 10, whatever that is. You want to be your happiest. You want to be able to do things that benefit others, but also fulfill you. Because after 3, 4, 5 years of doing something that you just have to do, you're going to burn out. We don't want to talk about burnout, but it's a very heavy conversation in the field of dentistry. You know that.
Well, it should be a conversation in all of dentistry. And I'm curious if you have any advice for those who maybe aren't content in the world of dentistry. What would your advice be to them? I know it's a hard one.
It's a heavy one, right? So let's take a step back. And if you're not content in dentistry, is it the environment you're in? Because I hear that from doctors a lot. Oh, I'm in this place. My assistant doesn't help me. My front desk doesn't know what's going on. You have to filter that out. And then that attitude from the doctor is put onto the patient. That's not fair. Because you're not happy with the staff, the patient shouldn't suffer. Agree? Right? The other angle is, I'm seeing too many patients a day. Okay, so that's you can change that. It's not dentistry. It's the volume you're seeing that's making you upset. That's a very common one. You probably hear from your friends also.
For sure.
Colleagues. The other one I see is they're doing things because they don't want to do. Right? Dentistry is so broad. We learn so many different angles of it. Let's use pediatrics. There's a lot of general dentists limited to pediatrics, and they don't want to do that. It's difficult for them to manage it. So it's difficult so where is that source coming from that's causing you stress that you're not happy in dentistry? And really step back and look at it. Is it the hours you're working? You might not be that individual who wants to do an 8 to 5. Maybe you can change that and have some alone time in the morning, go to the gym, take a walk, calm down, and start your day at 12, and maybe finish a little later. There's so many different formulas. We're lucky. We're blessed to be in a field that we have these different options versus other industries. You know, this is your line of work. This is your hours of operation. And it's not. Well, you're a great example. You're working at a federally qualified dental clinic. It's totally different than a private practice. It brings you fulfillment, and you're happy doing that. So I don't think it's one thing, but I really believe if you've gone through 4 years of dental school, you've had to enjoy 50% of it at least, or right?
Something in there.
Or something in there that got you to that point. Take out if you're on student loans, gone through undergrad, taking the DAT, gotten to that level. There's something that should keep you there, but to feel stress and say, I'm not content, I don't think it's dentistry. It could be multiple other factors.
Sure, of course. Yes, of course.
And then that's where you have to figure out, what is that factor? Is it the patient demographics you're seeing? Right? You're in a place that you're just doing extractions all day. Like, man, I really want to use my hands and do some veneer and composites, but I'm doing 5 to 10 extractions a day, and you're going to lose that drive and that fulfillment. So change it up, change the atmosphere, take a step back.
Yeah, our lives in dentistry have so many different levels and layers, and dentistry is beautiful because it has that versatility, and you can really find a spot and your niche that you want to practice in. But there are a ton of people who unfortunately aren't happy in the realm of dentistry and are struggling in it. And I hope that we as Ignite DDS, you and I can continue to create a community, a platform of support for those who need just somebody to maybe speak to and kind of hash things out. Because sometimes having an external ear can really help.
Yeah, you're driving to work and it's taking an hour and a half to get there. What is your mood going to be with that first patient? We don't have to. You don't have to dive into that. But what is your mood going to be after an hour plus drive, hour and a half drive? And it's not that patient's fault. Move closer or switch your job, or it's very flexible. We're in a field that's very agile and flexible to make ourselves happy and provide the best care for the patient.
Absolutely. Naved, if our listeners would like to connect with you, what's the best way?
Absolutely. We do have 2 pages, Health and Wellness Dentistry on Instagram, and also Dr. Naved Fatmi for the consulting part on Instagram also. And please reach out and follow us there.
Very cool. Any last thoughts before we close out today?
No, thank you for having me. And again, I want the audience to understand that we were all in the same situation. You were a first-year grad a long time ago too. We were all first-year grads at some point of our lives. But start looking at everything as what you want to do versus what you have to do, and then you're going to have a long, comfortable, easy career versus something you have to do in dentistry.
Naved, thank you so much for your time today. Have a great day.
Have a great day. Bye-bye.
Thank you for tuning in to our conversation with Dr. Naved Fatmi. Be sure to follow Naved on Instagram at Dr. Naved Fatmi. Don't forget, you can find us on Instagram at Dental Fuel and at Ignite DDS. Join us next time on Dental Fuel as we welcome another guest.